Hi, I'm Katy Thoma, President and CEO of the Chico Chamber, and today I am here with Judy Cline, and she is the Director of Emergency Services at Enloe. And actually her title's a lot longer than that, and also behind her name is a series of letters with some commas in between them. So I'm going to introduce Judy and have her give her title at Enloe and what those letters behind her name mean, to kind of get us going. So Judy, thanks for taking the time. I know you're very busy to meet with us. So give us your title and what all those letters are behind your name besides RN.
Okay, thanks, Katy. Yes, so I'm Judy Cline. I am currently the Director of the Emergency Department, Prompt Care, and Trauma Services at Enloe. Besides my RN, I am an MSN, which means I have a Master of Science degree in nursing. I'm a CEN, I'm certified in emergency nursing, and CFRN, I'm a certified flight registered nurse, and I was the former chief flight nurse for Enloe Flight Care for several years.
Wow, you must have lots of stories. I can't imagine up in the helicopter. That helicopter flies over my house quite frequently, and every time it flies over, I am so grateful that there is a team of professionals. And as they're heading out early in the morning, I'm always thinking it's those babies going to Sutter or burn victims, you know, as they're going over. I always imagine. And so I am extremely grateful for the helicopter and the teams that ride on that. So you've been in medicine for a long time. You've been in the healthcare industry. You've been a nurse for 35 years. So you are a well-seasoned, experienced nurse, seen it all. So I saw a PSA, I've seen it a number of times, you speaking about going in and getting care when you need to, because people are staying away from the hospitals. And when I talked to the fire chief, and of course they respond to medical calls, they have seen a significant increase of medical calls that require CPR because people aren't getting the medical attention that they need, and possibly an increase of deaths at home because people aren't getting the medical attention because they're fearful of going to the hospital or going to the doctor because of COVID. So maybe you could share with us about, as people are heading back to work, speaking to employers, part of the criteria for opening up, business owners and managers need to be sharing with their team, don't come to work if you're sick. If you have signs of COVID, reach out to your provider, reach out to Enloe, to Prompt Care. So can you share just kind of from the top about folks who are not getting care and why they need to get care?
Sure. So yeah, as you mentioned, Katy, one of our biggest concerns in the past couple of months is that some days our volumes in the emergency department have been down over 100 patients per day. So we're seeing 100 patients per day less than we were seeing pre-COVID. And so it's very concerning of where did these people go? Because we know that we have a primary care shortage here in Chico and the surrounding region. We know that people do need to use the emergency department for primary care issues, for long-term chronic health problems, but we just weren't seeing them. We were seeing an increase in the number of 911 calls that were for very serious conditions. Like you said, I think people were sheltering in place, perhaps ignoring their symptoms for too long, and then when 911 was finally summoned, they were in a condition that was at or near death in many instances. So that's why we put some PSAs out there recently to try and encourage people. We understand you're doing your best. You're sheltering in place. You're doing a wonderful job. People are under a tremendous amount of stress right now with everything that's going on. They have financial worries. They're homeschooling their children. And so we know even on a good day, people tend to ignore or put off health issues. And I think this has really magnified that problem. So as people are returning to work, they might be very anxious to finally get out of the house, yet they may have some conditions that have not been properly tended to in the past month or two. So we just want to make sure that they understand what their access points are. We actually have temporarily suspended our operations at our prompt care on Cohasset Road because of such low volumes. We just consolidated temporarily to our Bruce Road location. So we have the capacity to see people. We have the capacity to see people in the ER. Our hospital is safe. All of our clinics are very safe. And so if the reason is out of fear for coming, I just want to reassure everyone that these are very safe places for you to come. So what else would you like to know about that?
Well, what I can tell you is my experience. So I was walking up my back steps. My hands were full. I had a pair of flip-flops on that broke, and I tripped. And on tripping on my steps, I went down and I got this huge hematoma on my leg. And at first I thought for sure my leg was broken. It hurt. So it was one of those take your breath away kind of, impacts. So I went in the house and I grabbed a bag of frozen vegetables, which I don't normally have, but because we don't go to the grocery store that often, I have frozen vegetables. So I took a bag of Brussels sprouts, put them on my leg. It was on my shin. Put it on my shin and waited. And I did the alternating 20 minutes on and off. And so I thought, okay, I can take care of this, you big baby. What are you doing? Darn flip-flops. I should have thrown them away. So, and it hurt. It really hurt. So I continued. And of course, I went to Dr. Google and for my medical care. And I have very good health insurance, by the way. The chamber provides well for me. So, but normally I would have called my primary doctor and in this case, it was a Sunday, I would have just gone up to prompt care. But I didn't want to be a nuisance because I didn't think what was wrong with me was very serious. And if there were and this was in the beginning, and if there were really sick people, I didn't want to take the resources from the hospital to care for a hematoma, for crying out loud. And you know what happened? Of course, it got infected. And so 5 days later, I looked at my leg and it was red. And, having had raised children, I took the Sharpie on my leg, to see if it's going to move. And then I thought, what am I going to do? And then I had seen a thing on Facebook about how Enloe was doing this virtual ER. So I thought, oh boy, I got to do this. And so I did the virtual ER and it was so easy. And even from taking my insurance information and all of that. And I took my laptop outside in the light because my house is kind of dark, took the laptop outside, put it on the floor, on the ground. And the doctor examined me from my laptop and he actually had me put my legs together so he could compare the swelling and had me press down on the skin. And he's like, yeah, you have an infection. So yeah, it's infected for sure. So he called in a prescription for me. But anyway, all that to say, it was so easy, start to finish. It was 30 minutes. And I love you people, but you don't get in and out of prompt care in 30 minutes. And knock on wood, I don't ever have to go to the ER, but I've been to prompt care plenty of times. So it was super easy. So then I saw your PSA and I thought, you know what? It was really okay. You don't have to have a heart attack to go to the ER, or if you have an injury that you think you're okay, you should still go.
Yes, absolutely.
Yeah.
So our telehealth solution. Telehealth or telemedicine is something that Enloe has been looking at for several months as a platform to increase access to primary care. So it's a project we've been working on, but in response to the COVID situation and not seeing people show up to the ER or prompt care like they normally would, we were so concerned that we decided to kind of escalate it. And we really did an accelerated telehealth program. And we actually had it up and running within 9 days from the initial, maybe we should do this. And so I'm really happy to hear of your excellent experience that you had. That's very reassuring.
And it was cute because the nurse that helped me, it was her, this was at the very beginning, and it was her first time doing it. And it was also the physician's first time. And she had somebody behind her coaching. So as I picked up my laptop and I'm going through the house, of course, to go outside, and we come back. And then the doctor, we got all done. The doctor left. She goes, "Oh, we just want you to know we think you have a really cute house." It was really sweet, but it was so heartwarming, and they didn't make me feel like I was a bother, that I was totally appropriate. And why didn't I call 5 days before, kind of a thing. So I think, heart attacks, diabetes, for sure, they need to be going in if they need care, but also people that have simple injuries. I mean, cutting your finger with a knife, don't butterfly it yourself. You might need stitches. You might need antibiotics, might need a tetanus shot, that kind of
And the beauty about telehealth is that you can kind of describe what's going on, and we can kind of assist you to getting to the most appropriate access point, depending on time of day, or, whether it's a big cut or just a small one that would be easily taken care of by prompt care. Obviously, we're not going to stitch you up over telehealth. You are being seen by a doctor or a nurse practitioner in a very private setting, and so you're free to show us your injuries or what you're worried about, and then we can guide you. And like in your case, you didn't really require coming in face to face. We were able to manage it just over the Zoom application, which is what we are using. And so that's a great story, Katy.
Yeah, worked great. And your team was just fabulous, and they were just so friendly and warm. And like I said, they didn't make me feel like I was wasting their time, that it was totally appropriate, but that I should have gone 5 days before. So thank you so much for your time, and keep up the good work, and way to be flexible and pivot. And I know that we're all going to get through this together. And I know that you guys had that terrific flyover. Was it this week? Gosh, I can't remember. Last Friday.
That was beautiful.
Oh, wasn't that beautiful? So I know we don't thank you all enough. So thank you on behalf of the business community. Thank you so much for your love and your commitment to humanity. We really appreciate you.
Thank you, Katy.
All right. Take care.
Okay. Bye-bye.